Good morning, Mrs. Williston. My name is Brandon, and I'll be your nurse today, who's going to be helping with giving you your medication. So, I'm going to be administering your chemotherapy medication called Cisplatin. You may or may not have taken this one before, but I just wanted to cover some important teaching points and some educational points before we begin your infusion today. Is that okay with you? All right, excellent. Thank you. So cisplatin is a chemotherapy drug that we use to help treat certain types of cancer, and in your case here, it's going to be used to help treat your bladder cancer. And the goal of the medication is to slow or stop the growth of those cancer cells inside your body. And now, before we do give this medication, I did want to verify your name and date of birth. Thank you for that information. We'll check on your armband and in our computer system. And do you have any allergies to any prescription or over-the-counter medications? No? Okay, thank you for that information. Do you have any allergies to cisplatin or other chemotherapy drugs of your knowledge? No? Okay, thank you. The goal of the medication, again, is to slow the growth of these cancer cells in your body. And we wanted to know if you've received cisplatin before. Okay, thank you. That helps me to know how well you've tolerated it in the past. And I do want to go over some side effects that you may or may not experience with this medication. A common side effect is nausea and vomiting, which can sometimes be pretty strong with cisplatin. But we're going to be giving you some anti-nausea medication before and after the infusion to sort of help control that nausea and feelings of nausea and vomiting for you. Another important point to know is that cisplatin can also affect your kidneys sometimes, so we're going to be giving you some extra fluids through your IV today to help protect your kidneys and make sure that we flush that medication through your system safely. And we're going to be moderating your kidney function as well closely with lab tests, and we'll be monitoring for any signs there, okay? All right. And this medication can also sometimes affect your hearing as well, and I want you to do your best to notice if you ever have any ringing in your ears or changing in your hearing. Please let us know right away. And cisplatin can also affect your nerves as well. So if you experience any numbness or any tingling in your hands or feet, please report that to us as soon as you can as well, okay? Also, because this medication can lower your blood counts, we're going to be checking your blood labs regularly. You might be more prone to infection or bleeding, so it's going to be important to let us know if you develop any feelings of fever or if you notice any unusual bleeding on your hands or legs, things like that. We just want to know. And finally, please know that while you're receiving this treatment, it's very important to stay hydrated. We also want to avoid large public crowds or anyone who's sick next to you to help protect your immune system. Sometimes with this particular medication, it can suppress the immune system, and we might not have as many white blood cells and cells to protect our body. Today, I'll be staying with you to monitor if you have any reactions while the cisplatin is being infused, and I'll be checking on you frequently today, okay? Do you have any questions for me before we get started? Excellent. Thank you so much for your time, Mrs. Williston, and we're going to go ahead now and start with your cisplatin infusion. And I'll be right here if you need anything, okay? Thank you.